This paper looks at the safety and efficacy of maternal vaccination while pregnant. This is a population-based retrospective cohort study from Ontario, Canada, from between May 2021 and September 2022, where the mother received one or more doses of vaccination during pregnancy. Where from 142,000 infants in the study, about 86,000 infants were exposed to one or more COVID vaccines in utero. Where the important finding is that there was no association between maternal vaccination during pregnancy and neonatal readmission, where COVID vaccination during pregnancy was actually associated with lower risks of severe neonatal morbidity, so complications during the pregnancy, as well as lower risk of death and lower risk of NICU admission, in addition to a lower rate of 6-month readmission after birth. Where in this analysis, mothers were considered unvaccinated if they received no COVID vaccine doses, preconception, or at any point during their pregnancy. And mothers who received one or more COVID doses preconception but none during pregnancy were excluded. Where severe neonatal morbidity includes 15 diagnoses and 7 procedures during the birth or admission or within the first 28 days after birth. And neonatal mortality is defined as infant death during the first month of life, where neonatal readmission is within the first 28 days after birth, and then 6-month readmission is 6 months after birth. And in this study, this analysis, they excluded infants who died during birth, where the control group of vaccine unexposed was 56,000 and vaccine exposed was about 86,000. Where interestingly, mothers in the unvaccinated group were more likely to be under 30 years of age. They were not likely to have received other vaccinations like the flu vaccine, and were more likely to be lower income. From that approximately 86,000, about 41,000 received one dose, another 42,000 received 2 doses, and about 1,500 received 3 doses during pregnancy. Where the severe neonatal morbidity, neonatal death, and NICU admission were lower in infants of vaccinated mothers during pregnancy compared with unvaccinated mothers. Where for those vaccinated, the results were largely unchanged by the number of vaccine doses during pregnancy, the trimester of vaccination, which vaccine they chose, or the infant sex. Where the study largely provides further reassurance on the safety of maternal mRNA COVID vaccination during all trimesters of pregnancy for both newborns and infants. And it adds to the existing evidence that not only are there no apparent increased risks of adverse neonatal and early infant outcomes, but there may also be potential benefits by lowering the risks. And this is for people that are pregnant and vaccinated.